This is a chest x-ray, and these are chest CT on that same person. Let's look at the cross-sectional anatomy on CT in order to better understand what makes these shadows on chest x-ray. We'll start with the trachea. More superiorly, the trachea is midline, and then you see it deviate a little bit to the right, and then right and left mainstem bronchi. I think you see these better on CT. We'll start superiorly with the larynx, and then you see the trachea form. It deviates a little bit to the right as it encounters the aortic arch, and then inferiorly you see the carina, and then right and left mainstem bronchi, and then as I click through, you can see smaller and smaller bronchi as they penetrate the lungs. Next, let's consider the fissures which divide those lungs. On chest x-ray, it's the lateral view that shows the major fissures better, and you see the major fissure here dividing this upper lobe from lower lobe. And on the frontal view, you usually see the minor fissure better, inferior from that denoting the middle lobe. On CT, if I go posteriorly, then you see right and left major fissures here, dividing upper lobe from lower lobe. And you notice over on the right, I encounter another fissure here. That's that minor fissure, telling us that this is the middle lobe, inferior from it. Just one quick look at the axial view. As I go up toward the lung apex, make my way toward the person's feet, then you can see major fissure here on the left, major fissure here on the right, dividing those upper and lower lobes. I'll mention just a little bit more as we come inferiorly on this axial CT. You can see the esophagus here, and this is the azygos vein here. And as I go a little bit more toward the patient's head, you notice they come and they more or less touch each other, or they're contiguous with each other, and have an interface with the lung. And where they have that interface, then you can see the azygoesophageal line, which is this line right here. I don't see it on their chest x-ray, but you can see it clearly on other people. And the line will follow up to the azygos vein, which is right here. And as we follow the azygos vein to that area, you can see the azygos ascending, and then here's the azygos arch, and then you see it empty into the superior vena cava right here. And it's where the arch makes its way around the trachea right here and becomes a little bit more lateral. That's where it becomes visible here. And because it's visible, then you can see it on the it's one of the things you look for with chest, with certain chest disorders such as congestive heart failure, and when the venous pressure increases, you'll see some widening of the azygos vein right here. And this azygoesophageal line is important clinically too, because this is normal, but if it were to bow out, it might bow out because the esophagus is dilated, or because there's a hiatal hernia from the stomach making its way intrathoracic and bulging out that line. Or it might be prominent because of paraesophageal mediastinal lymph nodes. Again, from cancer, they can become enlarged, and so if you see a nodularity or bulging out here, you have to think about enlarged lymph nodes as well. Next, let's consider mediastinal shadows, and we'll start with the right border, beginning with superior vena cava, which makes up this shadow, until we get to this angle, at which point it will become right atrium. Let's change our windowing to look to the CT to see why. So if you look at the superior vena cava here, you see it makes up this shadow until it empties into the right atrium, which is right here, which makes up this border. On axial view, as we go superiorly, we'll see superior vena cava here, making up that right border until it empties into the right atrium here, and here's this right atrium making up that border. Now in some individuals, the inferior vena cava will be visible on the lateral view, right in this area. I can barely see it on this person. On coronal CT, here's the inferior vena cava, right here, entering that right atrium. And on the axial view, see the inferior vena cava here going into right atrium. Okay, so once the blood leaves the right atrium, it's going to cross the valve, which is right in this area, and go into right ventricle. And notice that the right ventricle is a very anterior structure. Because it's very anterior, you're not going to see it much on the right or on the left. It's more in the midline, so you won't see it directly on the frontal view. You have to go to the lateral view, And if you look at the heart border here, this is anterior, this is the sternum, and these are breast shadows. And here's the heart shadow. So go very anteriorly, and you'll be looking at the right atrium right through here. As blood leaves the right ventricle, it enters the right ventricular outflow tract, goes into the pulmonary trunk, which is here, and then at the right and left main pulmonary arteries. On a coronal view, this is right atrium, right ventricle here, right ventricular outflow tract. Pulmonary trunk is here, and then this is right and left main pulmonary arteries. Where the pulmonary trunk and aortic arch meet, there's a concavity called the aorticopulmonic window, and frequently you'll see a lymph node in that area. So when we look at these things on chest x-ray, here's a frontal view, here's the aortic arch, here's the pulmonary trunk, in between is a little concavity, that's the aorticopulmonic window. And we look for fullness there because in some people with cancer, and let's say it's spread to lymph nodes, and there will be a fullness here from those lymph nodes that have maybe enlarged. On the lateral view, here's the aorta that we're going to talk about in a minute, but the left pulmonary artery, main pulmonary artery, is here. It's considered another arch of the lateral chest, as it arches over and then posterior from the left mainstem bronchus, which is this dark circle here. When you looked at the coronal view, you can see the left pulmonary artery here draping over that bronchus. Now the right main pulmonary artery is, if this is left main pulmonary artery arching over here, the right is always a little bit more anterior from that. It's just a vague density in this area. That's right pulmonary artery. You can kind of see that it's more anterior on this axial view. Here's the left main pulmonary artery, a little bit more posterior. Here's the right artery, a little bit more anterior. And if you're looking from a lateral view, see how it's going to be coming right at you, which is why it's relatively round on this view. Now blood's going to return from the lungs through superior pulmonary veins, inferior pulmonary veins. Here you see them on the right, emptying into the left atrium, which is here on the left. Then these are superior pulmonary veins, and inferior pulmonary veins emptying here into the left atrium. And notice how posterior this left atrium is. This is the most posterior chamber of the heart. And so if it's posterior, then when we look to the lateral view, then the most posterior part of the heart will be that left atrium right back here. And it's superimposed on the frontal view, you don't really see it. From the left atrium, then it's going to enter, oh, here's the left auricle, interesting to see. And on the frontal view, it's supposed to be right, this little hump right here, but it's very difficult to see on a chest x-ray. Okay, so as blood leaves the atrium, then it'll go through the mitral valve, which is right here, and come into the left ventricle. So here's left ventricle. Notice it has a lot thicker wall than what the right ventricle does. Here's its chamber, and as we follow it more superiorly, you'll see it go into the aorta. So here's ascending aorta here, and the aortic arch, and then descending aorta, descending the chest here. And let's look at a coronal view. This is the left ventricle here, and then this is aortic sinuses, and then ascending aorta, the arch. You see the major vessels come off the arch, and then this is descending as we come on down the chest here. On the frontal view, this is the aortic arch right here. You see the descending aorta come down here, and on the lateral view, this is the aortic arch here. So there are two arches on the lateral chest, the aortic arch and left main pulmonary artery here. As for osseous structures, again, let's change our windowing. And you can see the spine back behind. This is the thoracic spine. You see vertebral bodies here, and you see the ribs as they make their way through the chest wall here. On the axial view, again, let's change that windowing to look at rib head, rib neck, rib tubercle, transverse process of the vertebra to articulate with them. And then you see the posterior angle, and you can follow those ribs on through the chest to its costal cartilage, which you notice doesn't have the mineralization like you see in the osseous part of the rib, and then it articulates with the sternum, which is right here. Other parts of the chest wall, you can see pectoralis musculature here, major and then minor. And this is the scapula, so you see subscapularis here. If we look to a frontal view and get in the area of the scapula, so subscapularis would be here, supraspinatus, infraspinatus, teres minors kind of hidden in here, some trapezius, and ventral or anterior from the pectoralis muscle. Then in this person, is a female, and so we can see the breasts here. You see the breast tissue in this area. When we go to the chest x-ray in the lateral view, it seems like we mentioned before that you see the breast shadows here on the lateral view. The bone looking from laterally, you see the vertebral bodies here, the intervertebral discs here. Pedicles come back. We're seeing parts of the ribs here, here, and here. You see a posterior rib angle. Sternum is up anteriorly. When you go to the frontal view, it's more difficult to see the spine because of mediastinal shadows and everything superimposing, but you can still see them. And the ribs we can see well as they are encountering the lung. The scapula is over here, clavicle, and then again the breast shadows here in the front.